The body speaks what the mind cannot. A deep dive into psychosomatics. In the United States, we face a silent epidemic. It is not viral or bacterial, but it is pervasive. Millions of Americans walk into doctors' offices every year complaining of chronic back pain, blinding migraines, debilitating digestive issues, and crushing fatigue. They undergo MRIs, blood panels, CT scans, and endoscopies. They wait weeks for results, only to hear the most confusing phrase in modern medicine: "We can't find anything wrong with you." This diagnosis, or lack thereof, often leaves patients feeling invalidated, as if the pain were imaginary. But the pain is real. The nausea is real. The tension is real. The culprit, however, is not a structural defect or a pathogen. It is psychosomatics. Psychosomatic medicine, from the Greek psyche for mind and soma for body, explores the profound interaction between psychological processes and physical health. It posits a truth that ancient wisdom knew, but Western medicine is just beginning to fully reintegrate. The mind and the body are not separate entities. They are a single, continuous loop. When we refuse to feel our emotions, our bodies are forced to feel them for us. This analysis explores how unexpressed emotions, specifically anger, resentment, and sadness, biochemically transmute into physical symptoms, and how our cultural context in the US exacerbates this dis-ease. 1. The physiology of suppression: how an emotion becomes a symptom. To understand how a feeling becomes a headache, we must demystify the biology of emotion. We often think of emotions as abstract, fluffy concepts existing only in our heads. In reality, an emotion is a physiological event. When you experience an emotion, say anger, your brain releases a cascade of neuropeptides and hormones. Your amygdala, the threat detection center, activates the hypothalamus, which signals the pituitary and adrenal glands, the HPA axis. Cortisol and adrenaline flood your system, your blood pressure rises, your muscles tense to prepare for a fight, and blood is diverted from your digestive system to your limbs. The energy conservation law of psychology. In physics, the law of conservation of energy states that energy cannot be created or destroyed, only transformed. This applies to the energy of emotion, motion, energy in motion. When we express an emotion, say shouting, crying, shaking, or discussing it, that biological energy is discharged. The nervous system returns to homeostasis, balance. However, when we suppress an emotion, that physiological arousal does not vanish. It remains trapped within the body. If you are angry at your boss but smile and remain seated, your muscles are still primed to fight. That tension has nowhere to go. Over time, this chronic low-level activation of the sympathetic nervous system, fight or flight, begins to erode physical tissue. The body keeps the score, holding on to the trauma and stress until it manifests as a symptom loud enough to force you to pay attention. 2. The toxic 3: anger, resentment, and sadness. While every individual is unique, psychosomatic research and clinical observation have identified patterns in how specific repressed emotions tend to manifest physically. 1. Anger, the fire inside. Anger is a high-energy emotion. It is heat, pressure, and mobilization. In American culture, overt anger is often stigmatized, particularly for women, who may be labeled hysterical, or in professional corporate settings where keeping your cool is currency. When anger is swallowed, it turns inward. The jaw and teeth. The most primal response to anger is to bare teeth or bite. Chronic, suppressed anger often manifests as bruxism or TMJ disorders. You are literally biting your tongue or clenching against the urge to speak. Cardiovascular strain. Repressed anger creates a pressure cooker effect. It is strongly linked to hypertension or high blood pressure. The blood vessels remain constricted, waiting for a release that never comes. Liver and gallbladder. In traditional Chinese medicine, the liver is the seat of anger. Interestingly, Western psychosomatics often sees liver issues or gallbladder attacks in people who hold on to bitter rage. 2. Resentment, the poison. Resentment is distinct from anger. It is anger that is cooled, hardened, and fermented. It is the feeling of being treated unfairly over a long period, often accompanied by a sense of martyrdom or victimhood. Autoimmune conditions. There is a compelling body of research linking chronic resentment and self-directed negativity to autoimmune diseases like rheumatoid arthritis or lupus. Psychologically, if you are constantly attacking yourself or holding on to toxic feelings, the immune system may mirror this confusion, attacking the body's own healthy tissue. Tumors and growths. While controversial, some psychosomatic theorists suggest that holding on to old hurts can manifest as growths, the body literally growing the issue rather than releasing it. 3. Sadness and grief, the heavy blanket. Sadness is a slower, heavier energy. It is associated with loss and the need for withdrawal. Respiratory issues. We associate grief with the chest. We feel heartbroken. Unprocessed grief often settles in the lungs. Conditions like asthma or chronic bronchitis can sometimes be exacerbated by smothered crying or an inability to take in life. Breath. Fatigue and depression. When sadness is not expressed, the body enters a freeze state, dorsal vagal shutdown. This manifests as chronic fatigue syndrome or fibromyalgia. The body feels leaden, exhausted by the effort of repressing the grief. 3. The organ language, common illnesses in their messages. The body often uses symbolic language. The location of the pain can provide a clue to the emotional conflict. The head, the control tower. Headaches and migraines are among the most common psychosomatic complaints in the U.S. The mechanism, vascular constriction followed by dilation.
The emotion. Migraines are frequently found in people who are perfectionists, highly ambitious, and hold a tight rein on their emotions. It is a disorder of control. The migraine forces the person to stop, lie down, and let go of control. It is often the result of immense self-imposed pressure. The conflict. I must do everything perfectly versus I am overwhelmed. The gastrointestinal tract, the second brain. The gut contains the enteric nervous system, which uses the same neurotransmitters like serotonin as the brain. It is incredibly sensitive to emotion. IBS, irritable bowel syndrome. This is the classic psychosomatic disorder. It is often driven by anxiety and fear. Diarrhea typically relates to a desire to purge or get rid of a situation quickly. It is a fear response. Constipation relates to holding on, stinginess, or a refusal to let go of old ideas or control. Gastritis and ulcers. While H. pylori bacteria cause ulcers, stress changes the gut environment to allow that bacteria to thrive. This is often linked to eating away at oneself with worry or trying to please others at one's own expense. The back, the support system. Lower back pain. This is practically a cultural phenomenon in the U.S. The lower back supports the weight of the upper body. Psychosomatically, it represents financial support and survival. Fear of money, fear of ruin, or feeling unsupported by family often manifests here. Upper back, the shoulders. This is where we carry burdens, shouldering responsibilities, feeling like you have to do it all alone, or carrying the emotional weight of a partner or parent manifests as the weight of the world on your shoulders. The trapezius muscle tension. The throat, the avenue of expression. Sore throats and laryngitis. When there is no viral cause, throat issues often appear when we swallow our words. It is the block against speaking one's truth, asking for what one needs, or expressing anger. IV, the American context. Why we hurt. Why is psychosomatic illness so prevalent in the United States? The answer lies in our cultural conditioning. The myth of stoicism and the hustle. American culture prizes productivity above all else. We are taught that time is money and that rest is for the weak. We glorify the grind. In this environment, emotions are seen as inefficiencies. If you were sad, you were told to shake it off. If you were angry, you were told to be professional. We do not have cultural rituals for collective grieving or wailing. We have happy hour and Netflix. We numb rather than process. Alexithymia. A significant portion of the population suffers from varying degrees of alexithymia, the inability to recognize or describe their own emotions. Many American men in particular are socialized to disconnect from their internal states. If you ask a man with alexithymia how he feels, he might say, "I feel like my stomach hurts," rather than, "I feel anxious and vulnerable." Because the mind cannot label the feeling, the body must present the symptom. The medical model. The U.S. healthcare system is excellent at acute care, fixing a broken leg, but struggles with chronic, systemic issues. We are a pill for every ill society. When a patient presents with psychosomatic pain, they are often prescribed painkillers, anti-inflammatories, or proton pump inhibitors. These suppress the symptom, the body's messenger, without addressing the cause, the emotional root. This often leads to the symptom migrating, as in the headache stops, but the back pain begins. The path to healing, reconnecting mind and body. Healing psychosomatic pain requires a paradigm shift. It does not mean ignoring medical advice. Always rule out organic pathology first, but once the structural causes are ruled out, the work becomes internal. Awareness and labeling. The first step is to convert the physical sensation back into emotional language. Technique. When pain strikes, ask, "If this pain could speak, what would it say?" Or, "What was I thinking or feeling 10 minutes before this pain started?" Naming the emotion. Example, "I am not having a heart attack, I am having a panic attack because I am lonely," can immediately reduce the sympathetic nervous system's arousal. Expressive writing. Research by psychologist James Pennebaker has shown that writing about emotional upheavals improves physical health. The practice. Write for 20 minutes a day about your deepest feelings regarding a trauma or stressor. Do not worry about grammar. Burn the paper afterward if you wish. The act of externalizing the emotion takes the burden off the body. Somatic therapies. Talk therapy, CBT, is helpful, but sometimes the trauma is lodged in the nervous system, not the rational brain. Somatic experiencing focuses on releasing the physical tension of trauma. Yoga and breathwork. These practices manually switch the nervous system from sympathetic, fight or flight, to parasympathetic, rest and digest. Setting boundaries. If your migraine is caused by an inability to say no, no amount of medication will cure it permanently. The cure is learning to say no. If your back pain is caused by carrying your family's financial burden alone, the cure involves having difficult conversations about money and support. Conclusion. Our bodies are the most honest friends we have. They do not lie. When we ignore our emotional reality, when we smile when we want to scream, when we work when we need to weep, when we say yes when we mean no, the body pays the price. Psychosomatics is not all in your head, it is all in your whole being. The headaches, the stomach churns, and the aching backs are invitations. They are alarm bells ringing to tell us that we have strayed from our truth. Healing begins when we stop trying to silence the body and start listening to the story it is desperately trying to tell. In a culture that teaches us to disconnect, the most radical act of health is to feel.